Hey guys, this is Wilson Von Dohlen, and I'll be presenting on lupus erythematosus. Lupus is a chronic autoimmune disorder that causes widespread, inflammation and damage of various organs. These organs are mostly the skin, joints, kidneys, heart, and brain. Lupus is a very unpredictable disease, causing anywhere from mild symptoms to very life-threatening organ damage and failure. And lupus has four forms. They are systemic, cutaneous, drug-induced, and neonatal. Lupus comes from the Latin for wolf because of the facial rash that is very common in lupus cases. Now it's called a butterfly or a malar rash. In 1851, William Osler described it as a systemic disease, mainly that it affects internal organs and not just the skin. In 1904, it was given a formal classification, and then, as we come through the 1900s, we start getting specific antibody tests to help detect lupus and other similar autoimmune disorders. There is some lacking information from low and middle income countries around the world, but there's estimates between about 3.5 to 5 million cases globally, and 90% of those cases are women. The highest incidence occurs between the ages of 15 and 45, which are childbearing years, and then highest incidence in African American, Hispanic, Asian, and Alaskan Native populations. So, risk factors are just, the gender by female age, at 15 to 45, and then highest in African American populations. There is a risk factor of having a family history of lupus, and then environmental risk factors are smoking, UV radiation, other infections like Epstein-Barr virus, chronic stress, and medications. So, going back to those forms of lupus, we have systemic lupus, which is the most common, occurring about 75% of all cases. It's also most severe and chronic. And that cutaneous, as the name implies, will only affect the skin. And it has three subcategories of discoid, subacute, and acute. And then that drug-induced lupus presents as systemic lupus. It's just the cause is linked to these certain drugs. Procyanamide and hydralazine are two known very common drugs that cause it, but it's been associated to over 100 drugs. And then neonatal lupus is not a true lupus because it's very temporary, and it only occurs because the antibodies that have transferred from mother to baby across the placenta, and it lasts in utero to a number of months after birth. So the symptoms vary on whether they appear, how fast they appear, how severe, and how long they last. And it's just a big thing about autoimmune disorders is these periods of flares and remission. So flares are when the symptoms appear and then they get worse, and then remission is when the symptoms can disappear or they improve. And the time lengths of flares and periods of remission is varies greatly, depending on how much they can occur, how long they last, and so on. And so in general, there's pain and swelling in the joints, there's skin rashes, fatigue, fever, sensitivity to sunlight. But as we see, so systemic, its symptoms kind of depend on which body system has been affected, considering how it can affect so many different ones. And then you don't necessarily present one form of lupus at the same time. Systemic lupus can see multiple different forms of cutaneous lupus occur. And so then each of those different subtypes of cutaneous each present in their own different skin rash. So discoid has disc-shaped scaly lesions that can plaque and scar, and those will be on the neck, head, and face. Subacute has red ring-shaped lesions on sun-exposed areas like your arms, back, and chest. And then acute will have that hallmark rash. It's called the butterfly or malar rash, which was where the name lupus came from. It's on the cheeks and the nose. Like I said, drug-induced lupus presents symptoms the same as systemic, and then neonatal lupus will have skin rashes post-birth, And if it was a serious case in utero, they may have developed congenital heart block. So here we can see images of the different skin lesions. You can see the discoids on the face there, and you can see it's more scaly, the ring-shaped and subacute, and there's that hallmark facial rash. This fourth picture is drug-induced lupus presenting as a subacute skin rash, and it's occurring on the upper thigh. And then here you can see those neonatal skin rashes on the infant there. So, autoimmune disorders are where the immune system has improperly recognized our own body's tissues and targeted them as foreign. And so that usually doesn't happen because of a term called self-tolerance, which is where our body can recognize our own cells and not treat them as foreign invaders. And so when you lose that self-tolerance is when autoimmunity occurs. So in general, we lose that self-tolerance, and then our B cells start making autoantibodies, which will target our cells. The autoantibodies will bind to the self-antigens and form these immune complexes. And those immune complexes then deposit into different organs, and they will build up, and then they are targeted for destruction by our immune system, which just causes massive inflation in those organs trying to deal with those complexes, but the inflammation doesn't get stopped when it doesn't need to continue, and that's what causes that damage to the organs. So lupus diagnosis is very hard to do because it does not present the exact same in each case. And then on the same note, its symptoms are shared symptoms with many other diseases. And they have still not located a single clinical feature to be like, that's absolutely lupus. So you have to diagnose it based on a combination of multiple signs and symptoms and tests. And then, here are just some diseases that present very similarly, like rheumatoid arthritis. A rheumatologist is a doctor who will, or they are the most common doctors who will prescribe lupus. So, to diagnose lupus, you usually, because it's an autoimmune disorder, you test for these autoantibodies. These anti-nuclear antibodies, antibodies that target our cells' nuclei. They are the hallmark of lupus, and that's like the first test you'll do. And you'll see the presence of ANAs in more than 97% of systemic lupus cases, but it's not specific because they'll present in a high number of other autoimmune disorders. You can also test for things like anti-dsDNA antibodies, which are very specific for systemic lupus. They have 95%, but they're not seen in a super majority of cases to say it's guaranteed to diagnose it. So there's no cure, and so the treatments are more to limit damage and improve quality of life. And so the treatment will be tailored to how severe one's case is. Less severe cases, you'll get NSAIDs and anti-malarial medications, and then more severe if you can administer glucocorticoids and immunosuppressants. So those NSAIDs are, treating mild joint pain, aches, and fever, and the anti-malarial is really cool, specifically hydroxychloroquine, because it's actually used in a very high majority of lupus cases because it prevents and reduces the severity of those flare-ups. And then those glucocorticoids and immune suppressants are, much stronger treatments, and so you use them when you need to rapidly reduce inflation and the autoantibodies being produced. So, just in recent history, they've improved survival and quality of life, decreased the amount of damage that happens when someone has a period of the flares, And then they've increased, education on lupus. All sorts of new drugs are being FDA approved. And then I read more about other drugs going into clinical trials. And so we'll see more. Like I saw one that goes on to stage 3 clinical trials. So that's another one getting close to being approved. And then they really want to reduce broad treatment with those drugs and have more targeted therapies, like targeting like the B and T cell surface receptors. And then they're doing research into mRNA vaccine techniques as well. Here are my sources. Thank you for watching.